Hi, I'm Dr. Pennau with Oral Surgery Associates of Colorado Springs. We're here to talk about bone grafting. There are a couple of different types and options of bone grafting. I'm sure that you've heard. Other people have stories about it. Basically, when we're talking about placing implants, the implants are titanium that they need to go into bone. There has to be good quality and quantity of bone. And if teeth have been gone a long time, there's often a shortage of volume of bone. If you're going to have a tooth removed and you're thinking about placing an implant, doing a socket preservation or bone graft at the time of the extraction is a very good way to help ensure that you're going to have quality bone to get an implant in several months. When you take out a tooth, what you're going to have is an empty socket. Think of that socket as four walls of a box, a cardboard box. The contents have been removed. Those walls are somewhat flimsy and they do collapse down. The same goes for a socket of a tooth. If you fill that back up with bone particulate, it's like bolstering those walls and you'll help maintain that volume and ensure that you have a better chance of getting an implant in. There are other kinds of bone grafts. Sometimes we use particulate grafts, which is bone from the shelf, which is generally what we try to do. Most of the time that's either cadaver graft or cow, bovine graft. That way we don't have to have any donor site pain or sites. Occasionally, if the volume of bone is quite insufficient, we do use some of your own bone. That can be taken from different places, either in your mouth or other parts of your body. Lastly, sinus augmentations. Sinus augmentations are a classic issue that we run into with upper back molars. When those teeth are removed, the sinuses which live up in the jaws just above those teeth will actually enlarge and the socket will shrink. If that happens, you're ending up having a deficiency in the height into which an implant can be placed. Sinus elevation has been done for many decades and is very predictable, quite safe, and has very low risk of sinus infection, sinusitis, and things of that nature. What we do typically is either an approach through the site where the implant will be placed, which is called a vertical approach, and oftentimes an implant can be placed at the same time as doing a vertical approach. If there's very, very minimal amount of bone, then we have to come in through the side. We have to lift up the gum tissue, remove a bit of the outer wall of bone. There is a membrane that separates the cavity of the sinus from the bone. That's called the Snyderian membrane. And what we do is we lift that gently and place bone between the floor of the jaw and the new floor of the membrane. The gum tissues get closed, and that bone will then heal and integrate over a period of about 6 months, at which time you should be ready for implant placement. On very rare occasions, there is a significant defect of bone. In a patient like this patient was missing all of her teeth for many, many years, and there was significant atrophy or resorption of the bone in both the upper and lower jaw, and the patient wanted to have implant-supported upper and lower dentures. In her case, we actually had to take her to the hospital and do a portion of hip harvest, and the hip graft was placed along the upper jaw. It was allowed to consolidate for approximately 6 months, and then implants were placed and then eventually restored with a complete upper arch prosthetic that does not have to have palatal coverage or could even be fixed and not be removed except professionally for your normal cleanings. If you'd like to talk more about bone grafting or implants, please don't hesitate to give us a call and schedule a consultation.